going to say, okay, I'll keep these two. I will continue the process, but now I have an opportunity to go back and recheck this at a later date in the subsequent visit and skew my reassessment to include more of what I should be looking for. So I think that is really the value of the history. And again, my hat off to Pavel Kolaj, because his experience is so vast that that is a risk he can take, because he has so many tools at his disposal that
Well, we're
he
saying the
can apply
collage thing.
them in.
I highly doubt he's never taking a history in actual
No,
clinic.
no, but I'm just saying that
Yeah,
he is successful when he
yeah,
does
he had a
that as a
successful.
sign of his ability to, again, read systems, assess systems, and not symptoms. It is the ability to assess systems that is the key, because the symptoms are general to many systems, systemic dysfunctions or system dysfunctions. So, that is really where it boils down to, are you good at internal medicine symptoms
Right.
for systems that will give you a clue that your symptom picture is skewed towards a particular systemic dysfunction or system dysfunction. So that's really what I think.
So I also wanted to ask, you know, what are you've been around a long time. You're an old, old clinician at this point.
I'm dying.
Yeah, basically, you're 1 foot in the grave, and I'll lift the other foot into the grave for you.
I'm circling the drain as we speak. I hope not. Yes.
Um, so in your clinical experience, what are there particular things, not necessarily like a specific technique or approach, that are just kind of, for lack of a better word, like overhyped? They're not giving you a whole lot of bang for your buck. Not really clinically that useful for you, at least, or and also maybe overhyped in terms of really overhyped. Like, I have no idea, but I'll just throw out there, like, oh, Mulligan mobilization that everybody loves is actually, you found, not really that useful or effective for you. What do you think are some things
Um,
are like that?
Really, in the end, my my concern is not so much about techniques that are overhyped as a lack of appreciation for principles. Many techniques can be effective and they can be ineffective in certain situations. Certain individuals may respond to one technique and another individual may not respond to that technique, even with the same diagnosis. The problem being that the individual is individual in his genetic makeup, his sensitivity, the drivers that will alter afferents to the brain have different weight in his case compared to another case. Meaning, there are obvious systems that carry high priority: vision, vestibular, skin, etc. But again, the concentration of receptors differ from individual to individual. The reliance of the CNS on certain afferents differs from individual to individual. So, it might be that you have someone whose foot sole is not particularly sensitive. So stroking it to relax the lower extremity is not going to work in this person. It's going to work in someone else, and so on. Or you have somebody who, for all intents and purposes, has very few receptors relatively in his meniscus. So he can trash it and not feel much pain. and the other person comes in limping and can't move the leg. Now, you will prioritize the patient accordingly. So my concern is that often people become um, masters of a technique instead of masters of principles of an approach to rehabilitation in which the techniques are tools and are not in themselves the be all and end all of treatment. Because technique is just that, it's a technique. But a principle can be applied and reapplied and modified, and it can shape the way in which the technique is applied. But the technique should not shape the way in which the principle is, is used. The principles are of a higher order, and they should be seen to drive the choice of techniques. So that is my experience over time, that you should be a master of principles and a jack of all trades. But to master
It's
one
easy
trade,
for you to say. Jack of all trades.
to
Well, today I'll
master,
do dry needling and mulligan mobilization and transverse
yeah,
friction and McKenzie and
yes,
neurodynamic.
because
I'll do all of these.
you are trying to affect afferents. So you must master different ways of affecting afferents. That's it. And then you must understand the rules under which the processing takes place and what the efferent result should look like. So those are the
Well,
principles under which we govern. And then the technique almost is a secondary.
I mean, it's kind of analogous to what we were talking about earlier in terms of the history and the assessment.
Mm-hmm.
The where the assessment or the history is only irrelevant because it's not going to change the assessment, but it has relevance. The techniques are not irrelevant, but they're only relevant if you have the right principles as a foundation to tell you whether or not your techniques were actually effective.
That's
And
right.
that always, I mean, we kind of always come back to that or say that. And I will kind of usually tell this little personal story of when, when I was in school and even well, immediately out of school, that myself and my friends and colleagues, it was all about learning a bunch of techniques. We
Mm-hmm.
wanted to learn the latest techniques, whether it was kinesiotape or
Mm-hmm.
acupuncture or whatever it was. We were learning a bunch of techniques. And you start to realize, hopefully, that it isn't about the techniques. It's about how do you test whether or not the techniques are effective? Because
Mm-hmm.
I always pick on dry needling. I do dry needling, but I'm pick on
Mm-hmm.
it, and it's just easy that if your only test or assessment to tell you whether or not your dry needling was truly effective is I rub and find a trigger point, I stick the needle in, I take it out, the trigger point has gone away. That's nice, but it isn't. That
That's not
isn't the most.
rehab.
Yeah, it's
Exactly.
not rehab. It's not healthcare. It's
No,
obviously symptom care,
it's pain
and
control, yes.
yes, it's pain control. So you need to have some type of principled assessment that takes precedence over and gives relevance to the techniques that you have.
That's right.
Yeah.
Yeah.
So you
If
sure you
you
don't want
enjoyed
to?
this conversation and want to hear more like it, then please like this video and subscribe to our channel. You can also stay up to date on our latest seminars on our social media pages on Instagram and Facebook at IMTR Seminars.